is Alberto. I'm a family nurse practitioner student, and this video is just for education purpose only. I'm going to show you a head, ears, eyes, and nose, and peripheral circulation exam. My patient here have a beard, so I have to change, and he wear glasses as well. I have to change a couple stuff. So starting, so the first thing that we do when you try this examination is the inspection. Let's start through the head. I'm gonna remove his glasses. Okay. Put this here. And we start inspection. Inspect the hair, the symmetry of the head. Take a look. The eyes and the ears. So during this inspection, I already checked for the cranial nerve number 7. Next step will be palpate. Now I'm gonna try to see if I see any mass on his head. I'm trying to, when I'm touching the scalp, right? For any lesion as well. And everything is fine. Now, the next thing that I'm gonna do is inspect his eyes. I'm gonna check the pupils. Open your eyes, please. His brows, his eyelids, and again his orbitals, and his lacrimal drainage. I'm gonna inspect the pelvis. So in order to do that, I'm going to use my pen to check for size, shape, and quality. So I also, once I'm here, I'm gonna try to check for accommodation. So can you tell me when you see my finger?
Oh.
Okay, and using my pen, I already checked actually the size of the pupil once I was checking. Let's check for accommodation. And during this accommodation, I'm checking when he follow my finger, I'm gonna check for cranial nerve number 2 and 3. So check this. Thank you. Okay, so now after doctor, I check for I'm gonna check for the fundus of the eyes. So I do have a fundoscope here that I attach to this part right here, but because it's just educational and it's not required to do the fundus, but this is basically what I use to check his fundus, and it will be straightforward. But that's not required, so for now. So okay, I also have the test for his eyes, the Snellen chart right here. That's also something else that I can check, and check for that. And accommodation, I already have the cranial nerves 3, 4, and 6 done. Now we're gonna move on for the ears. So for the ears, I have the otoscope. I'm gonna again start with the inspect the external ear. The otoscope actually have a light here that I can check. I can inspect the external, and I can also look the inside of the ear with the tympanic membrane I just need to see if I can visualize the cone of light inside the ears. Okay, still in the ears. Now when I can do the rhino test, that this is going for the cranial nerve number 8, and I can check doing this near to the patient ears and tell me when he's stop here. I can also ask the patient if he can hear this bilaterally and check behind his ears as well. That's the fork. So continue with the inspection. Now we're gonna move to the nose. For the nose, again, the otoscopy can actually help to check the nose because I need to check both nerves. Once I'm gonna do the nose, I can check the nose to see if the turbinate, to see if you have any deviate septum, and inspect the nerves. Once I'm doing this, now I'm gonna palpate his sinuses, the posterior, and this area right here. You ask if you have any pain, if you feel any discomfort when I do this. Still checking the nose. But imagine that this is alcohol swab, and I just need to do him to ask if he can smell like the alcohol, just to test the cranial nerve number 1 of olfactor. Olfactor, sorry, still it's memorized. Moving forward, we go into the mouth. For the mouth, I can, as all the examination, we start inspecting. I can inspect his lips to see if like dry, any cracks, anything. And I'm gonna ask the patient to open his mouth. So, sorry, I'm turning because my table with everything is here, right behind me. So can you open your mouth, please? No, just open your mouth. I have a tongue thing here to check. So I'm gonna check for his, open your mouth, please. I'm gonna check his tongue, his teeth, to see if he has any missing teeth. I'm gonna test for gag reflex, because when I check all that with the tongue depressor, I'm checking for cranial nerves number 12. I'm checking for cranial nerves number 9. I'm checking for cranial nerve number 10. So, and open your mouth, and I'm gonna ask him to move his tongue for left, right, up, down. You can close your mouth, please. Thank you. So, and I also have this that I can check his teeth in the words, but just not prolong the thing. So, he's still checking his face for the cranial nerve number 5. I can check the sensibility of his face if he's feeling, and I'm gonna ask him to close his eyes, of course, and tell him to tell me where I'm touching with this. So the next step that we're going is the neck. So for the neck, again, I need you again to inspect his neck. See if we any difference in once I'm inspecting his neck, I'm gonna check his thyroid. His thyroid I can touch. I just got a suggestion that if I do from behind is better. That's his thyroid. I can palpate and check his swallow. Can you swallow, please? Swallow. Good. I check for his trach. I can access his trachea. Once I'm in this position, I can start to do I can check for the lymph nodes. Um, Also, I can access for the JVD. But for the JVD, the patient have to be laid down, and I'm doing the chest, so I'm gonna skip that, but I can explain to you what to do. So I'm gonna have like ruler and the other ruler that I can measure his JVD once he's laid down in 30 degrees, I think. Um, so yes, so I'm gonna check for that. If he lay down, because he's not, he's just sitting. Let's continue with that. So once you check his neck, I'm going to listen to the carrot to see if you have any bruise, anything like that. In this case, I'm gonna use the bell of my stethoscope. I guess no bruise. So back to his neck. Now I can check for the lymph nodes. So we need to pay attention in that because he has a beard. So I'm gonna start with the submental that I use my tongue. That's right here, but he has a thick beard. So I can do the submandibular right here. I can do the tonsillar, the pre-auricular, the pause auricular, the occipital, the superficial clavicular, that's right here, the deep cervical, right here, and the pause, cervical, and the supraclavicular, right here. For the cranial nerve number 11, I can put my hands over his shoulder and ask the patient to shore up his shoulder. Can you shore up his shoulder? Yeah, and I see the resistance. So that will be covering the neck part. Now moving forward, we go into the cardiothoracic and vascular. So I'm gonna start, so in this case, of course, he gonna have no shirt on, and I'm gonna, but the purpose of the video, he doesn't want to remove his shirt, and I understand. I'm gonna inspect the precordium and his PMI, and then I'm gonna auscultate and palpate that area. I'm going to auscultate first, and I'm gonna use, in this case, the bell and the diaphragm of my stethoscope. So we're gonna start with the auscultate the thoracic valve, the pulmonic, the mitral, and the aortic. I'm gonna start doing the apical pulse. That will be in here. I do it with the bell and the diaphragm. I'm gonna do the mitral, that's still on the left, right here, with the bell, and I can do with the diaphragm as well. I'm gonna do the aortic valve, that's towards the diaphragm, right here, with both. Okay, so now moving forward, we go into the respiratory. The respiratory, we start to inspect the chest. Can you sit straight, please? Okay. We're gonna start to inspect his chest. See if he doesn't have any barrel chest. Checking his breathing. You can breathe fine, naturally. He's breathing air forward. The expansion of his chest as well. With the two hands, this position, I'm gonna ask him to take a deep breath. The front, take a deep breath. To check the expansion of his lung. And I'm gonna do the same in his back. Deep breath. Okay. So I'm going to feel it like his chest just to measure, because we want the ratio of 1 to 2 for his chest, just to see if he doesn't have, if he have a normal chest diameter. So now we go into percussion. The percussion we are gonna do the anterior and posterior. So use my finger. I'm gonna start with posterior first. So which says to look for donors of his the same for the proportion. I'm gonna do to the front. Deep breath. Yeah. So done that. Now we're going to listen to his lungs. Okay, I'm gonna, again, I like to start from the posterior. Deep breath. Just breathe naturally. The same we're gonna do the front. Okay, this is just a demonstration. Of course, we're going like deep and deep and deep and deeper. Now I'm going to feel the tactile fundamentals. So what I'm gonna do, I'm gonna put my hand right here and ask him to repeat for me 9-9. Say 9-9.
9-9. 9-9. 9-9.
Same I'm gonna do now, posterior.
9-9. 9-9. 9-9.
Okay. So with that, we cover most of it of the respiratory. Moving forward, we go into the peripheral vascular examination. So for the peripheral arterial examination, so again, we're gonna inspect his finger to see if it's no clubbing finger, to check like to see if he had blood return on his nail. I like to do the hands and the feet as well. So, but just an idea. And now we're going to feel all the pulses. We start with the radio, move on from the brachial. I like to do bilaterally, by the way. I always do like this because I need to feel both of them, and everything have to be bilaterally. So because in our system, no, if you don't do bilateral, we cannot compare the sides. And the dorsalipedes for both feet, the pit of pulses, the posterior tibia, the popliteal, and the femoral, that in this area right here. Okay, and so this is the peripheral. So with that, thank you very much for your help. We conclude head, eyes, ears, nose, and throat, and cardiovascular examination. I hope you guys enjoy and learn some today. Thank you.